Welcome back to the world. You're off the vecuronium.
Could you wiggle your toes for me?
The MRI was clear. Whatever this is isn't in your brain.
MRI. So, I'm not pregnant.
I'm sorry.
So what do we do next?
Well, it could be a variety of things. Some treatable, others more serious. Open up. I'm gonna run a genetic test for Huntington's.
That one of the more serious ones?
Yeah.
It's also possible that this is just a symptom of the fertility treatments. And now that we know you're not pregnant, we're going to start you on tamoxifen to counteract the estrogen.
Will that undo all the fertility treatments?
For the time being, yeah, but it could cure you.
You can start trying again once we get you healthy.
Damn it!
The spasms are going to get worse now that the vecuronium's wearing off.
What are you so scared of? I'm still your mother. I'm just a little sick. Why did you even bring her here? I told you to leave her at home.
Hypervigilance, sudden irritability.
Symptomatic of lunch with Cuddy?
The patient now defines Huntington's.
Then what do you need me for? Start her on Huntington's meds.
Before we get her test results back, we start on valproic acid. It could destroy her liver.
Stroke.
If we wait, she could progress to full-blown psychosis. Then our kid will never get the chance to say goodbye. Want to tell a class how that feels?
Huntington's patients don't progress to psychosis in a day,
She went from 0 to 60 in world record time.
indicating it might be something other than Huntington's.
We got a problem.
Stay away from me! Where's my daughter?
What's happening? She's having a psychotic break.
No! She is not yours! What do you want with her? Calm down!
Margot, you're gonna hurt someone.
No!
Just 2 milligrams out of there.
I want my daughter! She's not yours! I want my daughter! No more experiments! No!
Candy striper. So, you like dogs?
That's not a dog.
Smart kid. Are you always such a good little girl? Or does mommy sometimes say you're the reason she needs a double martini?
Who are you?
Over here, kiddo. I'm talking to you. Focus. Must be because you're off your meds.
Who are you?
Doctor and Candy Striper.
She's not on any medication.
Well, that's strange, because this bottle has her name on it. And I think these are medical pills inside.
What's he talking about?
Doctor prescribed Stella a few months ago. I never told you about it because I never gave her any.
It's funny, because the bottle's almost empty. You missed a couple of days. Take 5.
Stop.
Why? Unless they're not hers. You need some water, sweetie?
I'm not taking Ritalin.
Come on. All the cool moms are doing it. And Tox Screen says you're cool, too.
You were on drugs while taking care of Stella?
I'm sorry, Ted. It's a cafeteria menu.
Should take a couple of hours to process her. You can take her home and divorce her.
Yeah, that baby really moved. Oh, yeah, the transmission 2-speed qualified. Suspension.
What are you watching?
TV. What are you doing here?
Ted's with my mom. He asked a nurse to watch me.
What nurse?
She's not really watching me.
I got that.
Do you still have the balloons?
No.
Do you want to play something?
Nope.
When can Mommy come home?
Don't know.
What's wrong with your foot?
War wound.
Does it hurt?
Every day.
Is that why you're so sad?
Oh, aren't you adorable? I'm not sad, I'm complicated. Chicks dig that. One day you'll understand.
That's what my parents say when they don't want me to know something.
You say that a lot.
Only when they're talking about making babies and stuff.
When you catch them fighting.
They don't fight.
Not ever.
People who love each other don't fight.
Right. Forgot that. What floor was that nurse on who was watching you?
2.
Good talk.
At your age, the type of uterine cancer that develops is not likely to metastasize. It's very treatable.
Hey, hold still, Margot.
I'm feeling a little bit dizzy.
Oh my God.
BP's dropping.
What's going on? Get him out of here. What's going on?
Heart rate's 98 rising.
We've got to find that bleed.
Did you hit an artery?
With what? Hadn't even started the procedure.
Well, the surgeons are cutting out a chunk of your liver. Should I have them do a hysterectomy too?
A hysterectomy? I'm trying to get pregnant.
You don't have to lie to me. We're not married. You're a super mom. You can do anything. You work 7 days a week, you volunteer, you raise a kid. You still somehow find the time to lie to hubby number 2 that you really, really want to give him a child with his chin and pretty brown eyes.
What makes you think that I
Because it fits. Birth control pills caused a hepatocellular adenoma. Explains all your symptoms that aren't explained by your other lies.
That's it?
Also,
I'll have the tuna on rye. Would you like to leave my room now?
the tumor's benign. Stop taking the pill and it'll go away on its own. I'm canceling the surgery.
What are you going to tell my husband?
That I'm canceling the surgery. You can do the explaining. It's tricky, huh? It's one thing to say you can have a baby. It's another to say you don't want one. Personally, I'd make up some other lie.
Could I die on the table?
Could you die if you tell him the truth?
I need the surgery. I'm not on the pill.
Guess you didn't find your tumor?
The other doctors tell you that you were fine?
Yeah. In a sense, it's just my disease getting worse. You come to terms with this disease. You know it's there. You know it's waiting. And every now and again, take something away. Took my walking. Took my modesty. Now it's taking one of my last pleasures.
There's an outside shot. It's something other than the SMA is causing your eating problems. And if it is, we can fix it and remove that tube.
Is that my blood? It's green. What does that mean?
It means I'm not fired.
I thought melanoma was skin cancer.
Technically, it's cancer of the pigment cells, the same cells that give your iris its color.
Cancer. Why not? What else can God throw at me?
Hail, locusts, smiting of the firstborn. First, it all depends on how evil you've been.
House.
If it's cancer, it's spread everywhere, right? That's what's in my lungs, my kidneys.
There is a chance by removing the eye, get the primary tumor, and 3 courses of radiation, that could...
Could? What? A few months? Years?
More likely months.
Any of your other doctors have any cheerier diagnoses?
If they do, they're wrong. This is the answer. It's the only way to help you.
I already can't walk. I can't eat. You telling me that the rest of my life is in this bed, puking in pain?
We can manage the pain.
I'd rather just get this over with. I've been trapped in this useless body long enough. It'd be nice to finally get out.
Get out and go where? You think you're gonna sprout wings and start flying around with the other angels? Don't be an idiot. There is no after. There's just this.
House? You can't let a dying man take solace in his beliefs.
His beliefs are stupid.
Everybody lies. Some for good reasons, some for bad. This would have been a fantastic reason to lie.
Hi, Greg House.
Why can't you just let him have his fairy tale? If it gives him comfort to imagine beaches and loved ones and life outside a wheelchair.
There's 72 virgins, too.
It's over. He's got days, maybe hours left. What pain does it cause you if he spends that time with a peaceful smile? What sick pleasure do you get in making damn sure he's filled with fear and dread?
You shouldn't be making a decision based on a lie. Misery is better than nothing.
You don't know there's nothing. You haven't been there.
Oh, God, I am tired of that argument. I don't have to go to Detroit to know that it smells.
Yes, Detroit, the afterlife. Same thing.
You're not getting enough oxygen, so we're inserting a tube directly into your lungs. It should help us drain some of this excess fluid.
Should make you a little more comfortable.
Sats are still dropping.
Fluid's clear. If this was cancer, there should be blood. Call House.
He just paged me.
Dr. House!
How fast will this work?
New med should start helping in minutes. Okay, hang in there.
Accutainer's full. I need to replace it.
I don't think it's working.
Try and relax.
You must be wrong.
Stop talking. Hurry up and get the chest tube working.
Okay, I got it.
Can you get Hoover? I can't. Can you put my hand on his head? It's okay. Don't worry. I'm not scared.
Oh, God. Time of death?
You're looking better.
Stark's dead.
What are you doing?
Going to see our patient.
He's dead.
Dead is not a diagnosis.
You really shouldn't be.
Shut up. Give me my cane.
I assume we're all fired.
Should I fire myself, too? I thought it was strongyloides, and I thought it was cancer. A little help here.
Ready? 1, 2. Why'd you call me?
If I poop myself in front of Wilson, I never hear the end of it.
But why not one of the others?
You always had that phone in your hand.
We all have cell phones. That's not the reason. What is?
If I died, you'd never get the job. I knew you wouldn't let that happen.
You don't think anybody else has any reason to care?
I think this is starting to come back to me. It's right, left, then repeat. Yeah, that works. What did we miss?
If we knew, he wouldn't be dead.
That's it? You're just gonna give up?
No, we were defeated. It's over.
Patient presented with syncope. We thought it was threadworms, gave him ivermectin.
Thank you. Patient seemed better until his blood turned green.
Can we at least remove the body before launching into a purely academic exercise?
The patient didn't respond to antibiotics or steroids.
You okay, boy?
What's wrong with the dog?
He's dead. There are only a handful of viruses that can cross between dogs and humans, but they may not be connected at all. The dog was old. I've seen it before. They hang on way past their normal life expectancy to take care of their masters.
Did you watch him take the pills? The ivermectin, did you watch the patient put them in his mouth and swallow them?
I don't know. I think so.
What kind of dog is that?
English Shepherd.
It's in the collie family, right?
Not really.
They share the MDR1 gene.
Yeah.
What happens when you give a dog with the MDR1 gene ivermectin?
They don't. I mean, it's used to treat heartworms in most dogs, but it'd be fatal if the...
Look familiar? I think the last time you saw it, it didn't have that dead dog's teeth marks on it.
I just put it on the bed tray to get him some water.
When I asked you if you watched the patient swallow the pills, the right answer was no. Take his body down to the morgue.
Are you thinking about taking drugs? Well, think again, because drugs are not the answer. Take it from me, Hank Wiggin. Oh, don't remember this ugly mug? 2 years ago, I was a star. I won 9 games in a row. But by the end of August, I was gone. Cut! Cut! Not good, huh?
Oh, you caught the ball.
Yeah.
Look, I usually don't give line ratings, but let me try this. Here.
Hollywood ain't holding its breath.
Yeah, well, they're doing it wrong. I mean, for Hank.
Tell the director.
I thought I'd give the marriage a few months before I'd go for the meddling wife thing.
His arm came back day after he looked up. I say meddle.
You okay?
Just gas. Go help your man. Give me a little room here to work it out.
Take it from me, Hank Wiggin. Like that?
No.
Hey, sweetheart.
Hey. Hi, Brian.
Hey.
You boys having a little trouble with the big speech?
Yeah, you got any ideas?
It's your story. Just be yourself. Drugs were there, you took them. Simple. Why'd you get clean?
Because I was gonna die.
And come April, because you're clean, you're starting opening day against the Yanks.
Try it our way.
Yeah.
Okay. Let's start with the second part first. That'll get him in the groove.
We'll do the throwing thing first. Everybody wants to direct.
We're all right.
Yeah, he's good. You just bring it, babe. Just tell your story.
Roll cameras. Rolling. Sound. Speed. Come on, kid. Show 'em what you're gonna give the Yankees.
All right. Action.
We're gonna need a urine sample.
Oh, no, you don't trust me. Baby, I'm worried about taking this morphine.
You're in pain. The doses are monitored. It's not a slip. Besides, opiates weren't your thing.
They should have been. Whoa.
Mr. Wiggin, the urine sample. I want to say no. So I am. No.
Trust is a big issue in early recovery. He really did gain the weight, honestly.
If you say so.
You're not getting it.
Thinks I'm an idiot. He sure does.
osteopenia messing his bones up, hypogonadism, impaired liver function, kidney function, and we have managed to find the only professional athlete in the galaxy who is not on steroids. And it's not cancer. So what's killing him? Who shares my suspicions that the Yankees were somehow involved?
Shrunken testicles indicate his body's not putting out enough testosterone.
Throw out the lungs. That was the Lupron. My fault. Don't worry, I'll send him a nice note.
What about something environmental? Arsenic, mercury? The symptoms could indicate...
Pretty small environment. Wife's fine, no one else is sick.
If you throw out the kidneys, everything else adds up. The testicles, the bones, the impaired liver function could all be caused by a breakdown of his adrenal glands.
Addison's disease. I like it. Mainly, of course, because the treatment is...
Steroids.
Enough irony for all of us.
Treatment will cause him to retain fluid. With the kidneys almost shut down already, he'll die.
Oh, well, get him a new kidney.
Your theory is that Addison's is causing all the symptoms except for the kidney problems. What's causing the kidney problems?
Cameron, if you had to make an ironic guess right about now.
He tested negative for steroids.
Agreed. He's not on steroids now. But if he was on them at any time in the last 5 years, it could have caused the kidney damage. You see, kidneys don't wear watches. Sure, gallbladders do, but it doesn't matter because kidneys can't tell time. Steroid damage could take years.
No steroids. How many times does he have to tell you?
I don't know. How many times did he lie about cocaine before coming clean with the league?
It's completely different.
Oh, that's right, I remember. You never did come clean. The league was out to get you. They faked the blood tests. You had to get yourself a lawyer and everything.
If Hank says he never used steroids, that's the truth.
That's too bad, because our theory is that the kidney damage is caused by A and everything else is caused by B. The beauty of this theory is that we can treat A and B. But if you add the kidney symptoms back into the mix, then we are looking at another letter altogether. One that is apparently not in the alphabet. We can't fix the bones. No more baseball. No more breathing. No more brain function.
Get another explanation.
Okay, yeah. I think I got one in my other pants.
Hold on. 5 years ago, Bangor, Maine. My pitching coach had me on something. I never knew what it was.
And you never tried too hard to find out either.
I gained 12 pounds of muscle in like 4 weeks. I'm sorry, man.
Still with us, Hank?
Yeah, man. My chest feels funny.
Tachycardia. Your heart's beating too fast. We're sorting it out, but you stay with us, all right? Keep talking to us, Hank.
Where's the wall? 10 units of insulin sub-Q and IV push D.
Still dropping.
Why is his potassium up?
Damned if I know.
Okay, it was like 2. We gotta suck the potassium out of him. We gotta get his heart rate down.
We need a crash cart.
Got it.
It's definitely not Addison's.
It's not steroids either.
Help in here, please. His heart rate is 130 and rising like a Randy Johnson line drive.
A for effort.
There's no point in doing the transplant. Even if he was stable enough, it's obvious that we have no idea what's wrong with him.
First it's too high, now it's too low.
His heart's not responding to the atropine.
Heart rate's down to 40.
I thought it was up.
Now it's down. Last time he went out at 35.
What's wrong?
I have no idea. Hit him with the atropine before he gets to 35 again.
We've already given him 3 milliliters.
Apparently that's not enough.
Can't stabilize his heart rate.
What did you do to him?
KXLA.
His pulse was through the roof. So's his potassium.
We wouldn't do this.
Something did. Call me when he's stable. Or dead.
I'm gonna need another urine sample.
What for?
Sure. Whatever you want.
Why wouldn't you give it to me before, but now it's no problem?
I'm dying, right?
So you've got nothing to lose this time. Begs the question, what were you worried about last time? The funny thing is, when we tested you before, we were just looking for steroids. What should we look for now, Hank?
Hank, what's the story?
A little weed every now and then when no one was looking?
I don't believe this. We quit.
You did. If you kept going, you wouldn't have just lost your sense of smell.
Look, I quit the hard stuff. I just needed to relax.
Based on the symptoms, you're a lot more than a social user.
So you've been lying to me all this time.
I'm sorry. There must have been cadmium in the soil where the marijuana was grown. Some people get bone loss, kidney failure, some people's testes shrink, and some people lose their sense of smell. We'll start treatment right away. You should be fine by opening day. Baseball's in the summer, right?
It didn't hurt the baby, did it? The cadmium?
If you've been clean, the baby should be fine.
Okay.
Please. I'll stop everything. I'll go to meetings every day. Oh.
Twice.
It's usually the worst on my palms and the bottoms of my feet. I get these black dots all over them.
I don't see anything.
It comes and goes.
You sure it's not just scrapes and bruises?
I know the difference between a rash and a bruise.
Sometimes it's harder than you realize to distinguish between the two. You obviously exercise.
My problems aren't caused by my workouts.
But you do work out. And by the look of you, pretty strenuously. That's not usually the case with patients whose principal complaint is chronic fatigue and joint pain.
I was in the Marines for 12 years. I'm used to doing PT every day. Just because I can push through the pain doesn't mean it's not there.
We're not saying we don't believe you.
The hell you aren't.
We just need to be specific about what exactly the problems are.
I sleep 10 hours a night, but I feel tired all the time. I constantly get coughs, rashes, sore throats. My knees and hips feel like someone poured sand in my joints. Get these weird tingling sensations in my legs. Sometimes they're cold. Other times, it feels like my blood is boiling. Specific enough? Look, I don't care what you guys call it. Gulf War syndrome, Iraq fever, or just crappy sickness X. I just want someone to figure out what it is so they can cure it.
Hello? Is anybody out there? I think there's a problem in here.
What's wrong?
What do you mean, what's wrong? You don't smell that?
Nothing smells, John.
Are you kidding me? It's disgusting.
How long have you thought... Wait. Open your mouth. The smell's not in the room. It's in your mouth.
What's going on?
Good question.
All right. You're gonna feel a little burn. You never even dipped? Chewing tobacco. Practically everyone in my unit did. But me. I was so paranoid about cancer.
Well, if it's parotid cancer, it's very treatable if diagnosed early.
My mom had cancer, which is why I know that diagnosing cancer early means before there's any serious symptoms. Certainly tastes like a pretty serious symptom, you know?
We'll know more after the test. Okay, this time you're gonna feel a little pressure. We're injecting the contrast material.
Hey, could you turn up the music?
Sure. Looks pretty good so far.
Still can't hear it that well.
Can you hear it now? John? John! John, can you hear me? Still no relief?
I got relief. Just got no pee.
If the pills didn't work, you may need a catheter.
You didn't come here to talk to me about my pee. What's going on?
He's got cancer, all right. But it's not in his salivary glands. It's in his brain. And it's bad. At least 6 tumors, maybe more. He lost his hearing. His sight's probably next.
Death is probably next.
How is he?
He's dead.
Oh, God.
At least he will be in a few days. The question is why? The only explanation is that the VA hospital screwed up.
There was definitely no mix-up. I had them recheck.
Yes. Why would a government agency lie to cover up a mistake? It might have caused the death of the guy to be trying to kill for the last 2 years anyway.
He didn't lie. Did you just take 2 Vicodin?
No, it was an antidepressant. I was told to take 2 every time you walked into the room.
The VA scan of his brain. No tumors.
Yes, this is proof positive that someone didn't have tumors in their brain.
You see that bright spot below his left orbit? That is a titanium pin your patient had inserted 20 years ago. Unless you think the VA happened to mix up his scans with someone who had the exact same pin, they didn't screw up.
You paged us?
Why didn't you send his urine to Lester like I told you?
Because you told me not to.
Why'd you choose that moment to listen to me?
You think depleted uranium might have something to do with these tumors?
Radiation's the only thing that will make tumors grow that fast.
High doses of radiation. Even if he ate depleted uranium bullets for breakfast, he still would have been exposed to less radiation than we've given him in the last 2 days.
Do it anyway. And you, call his uncle back. Find out if he ever brought his nephew to any hospital parties or fundraisers.
No. Not until you give me a reason.
Because I'm your boss?
A rational reason. Or at least admit that you don't have one.
I've got a full bladder. I'm not afraid to use it.
But you are apparently afraid of discovering something you can't rationally explain.
Shut up! Do what you're told. Cuddy and Wilson may not have to listen to me, but you do.
What the hell is that all about?
I don't care, which is why I didn't feel the need to ask him 8 personal questions.
I'm over him.
Just making an observation. All right, ready whenever you are.
I'm ready. Wait a minute. Zoom in. I don't see it. You sure you're at the right coordinates?
Yeah, she's in the right place. Go 10 millimeters above the ACPC line on the Z-axis.
10 mil above ACPC on Z.
It's not there anymore.
Are you sure you got the gantry angle right?
Yeah, I'm sure.
It's not there. It disappeared.
6 tumors don't just disappear.
Unless they were never there to begin with.
The VA didn't screw up.
Maybe someone else did. Maybe it was Dr. Self-Righteous.
I saw the tumors. There was no mix-up.
Maybe there's something wrong with the portable imager in the OR.
Something that would cause it to show brain tissue in perfect detail, but completely miss neoplastic tissue?
And they were never tumors to begin with.
I told you I saw...
You saw something that looked like tumors. We all did. We were all wrong. Well, maybe he doesn't have cancer. Maybe he has a brain infection. It's causing multiple abscesses.
That miraculously healed?
No, they were healed by the antibiotics we're giving him for the vaginosis in his mouth.
If it's an infection, why didn't it show up in his blood work?
I don't know. Yet.
Dr. Wilson, we have a problem.
What did you do? I can't feel my legs. I can't feel my legs. What'd you guys do?
John, calm down. We didn't even operate.
This be a residual effect. I can't move my legs.
It's not the anesthesia.
John, we're gonna figure out what's wrong with you. But first we need to know one thing. Have you ever appeared in any pornos?
Incident on the Garden State Parkway southbound at
where
exit
were we?
91. That's
Have a nice night?
Yes, I did, thank you. I'm guessing better than our patient. Probably due to his BP and hematocrit plunging.
How'd you know?
The answer was staring right at us the whole time. As plain as the nose on our faces, or the nose on his face.
What's going on? What'd he say?
No hairs and cauterization scars.
Which means?
He had it cauterized.
How could you know that?
This makes sense. Undoubtedly done to stop the same childhood nosebleeds that plagued his grandfather. Undoubtedly because they were both born with hereditary hemorrhagic telangiectasia.
What's he saying?
I'm saying we've got a genetic disease that's destroying your capillaries.
That no one in his family's ever been diagnosed with before?
Not surprising, since the most common initial symptoms, skin rashes and nosebleeds, are often written off as a result of minor trauma or dry weather. But they can also be the result of his arteries and veins merging together. He obviously has AVMs. AVM near the spine caused the paralysis. AVM in his lungs prevented his blood from being filtered. Dirty blood caused the joint pain, fatigue, and the infections in his mouth and brain. Nothing that a few surgeries won't clear up. Get MR angiograms of the aforementioned. The Marines weren't hiding anything. He was. Or at least he forgot to mention his bloody tissue issue.
What's going on? What'd he say?
Grody.
It's like massive tissue death.
Who cares? Her head blew up. How cool is that?
It's not pussy.
Meaning you don't think it's an infection. And you'd be right if you weren't wrong.
Here we go again.
She's got infections that come and go, which means...
It means it has to be something else.
Good guess, but no. It means either she's got a leprechaun in her colon, just playing with the doggy door, letting bacteria in and out, or she's got complement factor H deficiency.
You enjoying this?
I'm saving a woman's life. I'm saving a woman's life. Actually, I'm diagnosing her. Technically, I'm diagnosing her with something that's gonna kill her, but other than that, I am saving her life.
An autoimmune problem makes more sense.
You can't explain transutated pleural effusion with giant cell arteritis. You need 3 whiteboards and 100 different colored markers.
No, it's much more likely she has an invisible protein that allowed bacteria to arbitrarily invade her lungs, then arbitrarily invade her pleura, then arbitrarily jump into her head.
If it's autoimmune, she can live. But we have to give her steroids now, before her heart ruptures.
If you're wrong and you give her steroids, she dies now. Foreman, you want to run down how it feels to go with your gut and kill a person? You can get into the whole spiraling out of control, self-doubt, resigning thing. Do it. Worst that can happen is you quit. Cameron, you want to explain to the parents why you'll be holding paddles while he's doing it? If her heart goes boom, it'll boom right away.
She really has to be awake for this?
If there's a problem, she could tell us what she feels.
Relax. We're scared. I don't want you to be scared. Things get better. Okay, sweetie? We love you. I'm sorry.
Ready?
Ready?
My patient's about to have a heart attack. It's gonna be massive.
Oh, well, that's too bad, because I just got tickets to a stroke on the 3rd floor. Have you had a conversation with Foreman?
Do me a favor.
You haven't. Because then you would have to confront your own emotions.
Is bile an emotion? I can definitely feel something here. Give me some licorice. This is gonna be the best heart attack of all time. Oh, wait. She's gonna shock her.
There's always tomorrow.
I'm sorry. Addie, you're dying.
Are you sure?
Yes. Your infections will get worse. The toxins will spill into your blood.
How long?
2 days, maybe less. You have a condition called...
Doesn't matter.
It's a very rare protein deficiency that only manifests...
I don't want to hear it.
Okay. What's killing you? This is what's killing you. You're not interested in what's killing you?
Will it make any difference? Will I live any longer? Please, could you just leave?
What's the point of living without curiosity? Without craving the...
So, I'm screwing up my last few hours because I won't listen to you.
Get out of here.
This is like the dark matter in the universe.
You're smiling.
No, I'm not. You can only diagnose a problem by looking at what's missing. Oh, God. I have to go. Ha! 19-year-old didn't want to hear the coolest explanation of why she's gonna die. Begged me to shut up.
If you can't shut up, at least talk quietly.
Amphetamine withdrawal's a bitch. She thought that I was happy.
You were happy.
No! I was hazy. And I don't get hazy on Vicodin or anything else I throw down. Which means I was throwing down something I didn't know I was throwing down. And which got me to wondering, why didn't you give me those happy pills?
I told you, you gotta be checked out
No, you just didn't want me double dosing. You dosed me. Those coffees...
They worked! You've been smiling, relaxed, happy.
A dying girl thought I was happy. A moron thought I was happy. Who the hell doesn't want to know why she's dying?
House was happy.
Hazy.
Happy.
Hazy!
Oh, right. A dying girl mistook hazy for happy because dying people see happiness everywhere. She's miserable.
She wasn't miserable.
Of course she was miserable. You just told her
She was no different than she'd ever been. She was no different than she'd ever been. Oh, God. I gotta go. Need a minute with your daughter.
Dr. House, get out of here before...
She's gonna live. Does that help? Now get out.
Are you jerking us around?
Get out. You have got leprechauns in ya. Depression manifests in lots of different ways. Some people can't get out of bed all day. Others have serial relationships and become oncologists.
I'm dying. I'm not depressed.
Wrong and wrong. You tried to kill yourself by throwing down kitchen cleanser. Now, most normal suicidal morons would have just drank the stuff, burned the hell out of their mouth and throat. Painful, but not deadly. But being a college-educated suicidal moron, you wrapped it in gel caps or gum, which left no trace, but burned a hole in your intestine. But the body can repair almost anything, which is cool. In your case, scar tissue closed up the hole, but it also formed a bridge between a vein and an artery. Veins are supposed to help the intestine flush bacteria away, but the bridge allowed the bacteria entrance to the artery, where they got a free ride everywhere.
Can you fix me?
Surgery to fix the bridge take about 2 hours. Psychotherapy's gonna take a little longer. Why'd you do it?
I don't know. I've just never been happy. Please don't tell my parents. They'll blame themselves, and it's not their fault. Please, you can't tell them.
Technically, all you have to do is promise me that you won't do it again. And legally, I can't tell them.